Everyone has the right to return home from work safe and sound. Sadly, this is not the case for the nearly 3 million workers who die each year due to occupational accidents and diseases.
Nor for the hundreds of millions more who fall sick or are injured at work. ILO standards in occupational safety and health foster safe and healthy working environments to prevent such human tragedies.
The COVID-19 pandemic has put the need to safeguard workers at the center of the global agenda. Around the world, workers and employers' representatives have collaborated to develop workplace policies and strategies to protect people from the virus and other related risks.
They worked closely together to create and put into place mitigation plans, including screening processes, contact tracing, and other measures to reduce the spread of the virus in the workplace.
This year's World Day for Safety and Health at Work highlights the importance of social dialogue in promoting a positive occupational safety and health culture.
Social dialogue refers to the active participation of representatives of workers, employers, governments in all phases of occupational safety and health decision-making.
Workplaces with higher worker engagement have reported 64% fewer safety incidents and 58% fewer hospitalizations.
This shows that open communication and cooperation between workers and employers is the most effective way of reconciling interests and implementing policies that save lives.
Let's act together to build a positive safety and health culture.
Well, that powerful message underscores why it's so important that we all observe the World Day of Safety and Health at Work. Well, today you can listen to us in English, French and Spanish. Interpretation is available when you select the language you prefer by pressing on the bottom of your Zoom screen on the global icon. And please remember to mute the original audio. Now, for technical reasons, you, the audience, will have your microphones and videos muted. You are, though, very welcome to share your thoughts. And indeed, we're getting many greetings from many of you. And hello back from all the different countries you're joining us from. And please, of course, you can also submit questions in the chat box during the event. And representatives from the ILO will be able to respond to your questions after this event. And speaking of our panelists as well, for you, do please activate your video when you are taking the floor and deactivate and mute yourselves when you're not speaking. Now, this event is also being live streamed on YouTube, so a big hello to everyone watching us there. I'd like now to introduce our first speaker, and that is Ana Mendes Godinho, the Minister of Labour, Solidarity and Social Security of Portugal, for her opening statement. Minister, the floor is yours.
Hello to everyone all over the world, and a big hug from Portugal.
Now, I believe, Minister, you have muted yourself accidentally. We can hear you now. Fantastic.
Perfect.
Take the floor,
okay.
Please.
Yes. So, good day for everyone all over the world. Good day from Portugal. Good and inspiring World Day for safety and health for everyone at work and for everyone that has the power to decide and to move and to change what needs to be changed. I would like firstly to address and thanks to ILO Director General.
I'm afraid, Minister, we have you on mute yet again.
There's a problem. Let's solve the problem.
This is the problem with Zoom and webinars, but please go ahead. We hope we can hear you loud and clear now.
Warn me whenever my voice goes out, okay? Thank you.
I will.
So I was thanking and congratulating Guy Ryder and also, of course, ILO for this initiative. We've been celebrating for 29 years the prevention of occupational accidents and diseases. And I think this is also a way to remember and to congratulate all the workers and stakeholders and employers and organizations that every day work for ensuring better working conditions. I could not start this without also thanking Joaquim Nunes, who has been a permanent inspiration during my life, where we met when I was a labor inspector. And I have here to remember my life and my experience as labor inspector, where I had the time, and I was so many times called to investigate the causes of fatal and serious accidents that took place in workplaces, and how so many times it was so difficult to deal with the loss and the tragic consequences it had, not only in the worker's life, but also in families, and how sometimes it was easy to understand that little changes could make the complete difference in so many lives if they had been taken previously before the accidents. And of course, we all, and this is the moment to highlight the key elements and how crucial it is to guarantee that OSH management systems do include always and integrate the business management as a whole. So being part of the all decisions, because they can make the difference in everyone and the worker's life. Of course, it is critical to have this integrated and holistic approach to guarantee that at all levels of decisions, OSH is taken in place and the life of people are in the first step of our decisions. Of course, at the same time, we can never forget and we can never lose in our mind the report of OSH issues and guarantee that employers can never be fear of punishment. That was highlighted in the report. We cannot accept that workers are afraid to tell what's going on because they are afraid of the consequences they can have in their work. Well, of course, at the same time, we have many challenges going on, digital platforms, teleworking, new challenges of new risks that are taking place, and we must call for a protective framework that enables indeed workers to effectively exercise their right to refuse unsafe work. This is a right and this is an obligation to us all. Let us also create the conditions to reduce precarious work. As we know, it is so linked with sometimes difficult conditions for workers in a safe legal environment that prevents vendetta from other behaviors. Well, let us just let me just share with you. We are putting in place an agenda for decent work where all these issues are included, and that we are created for the first time concrete incentives and positive discrimination for enterprises and employers who have active and intense social dialogue that include these issues, because this is crucial to guarantee that everyone is part of prevention and of identifying the risks. Let us all, at the same time, reinforce the powers and the resources of labor inspections, not only in terms of IT, but in terms of AI, which is crucial to prevent the rules. Well, let us finally remember, and this is a final call for action, let us remember all the workers that died or had injuries or diseases. And my final words are indeed a call for continuous improvement, namely in the workers that have more vulnerable situations or are under more vulnerable conditions, such as women, such as precarious workers, such as young workers that are entering the labor market, and migrant workers. And in this, I have to call for all your words and movement into supporting Ukrainian workers that are now being forced to move from their country to find peace. Let us stick together and stand for Ukrainian workers, namely in terms of guaranteeing their real inclusion in our countries, in our labor markets. Let us act together.
Well, thank you so much, Ana Mendes Godinho, the Minister of Labour from Portugal. That was very well and powerfully said. And next, we have recorded statements from other ministers from around the world. We start with Malek Ezzahi, the Minister of Social Affairs for Tunisia. He'll be followed by Jeannette, Alejandra, Jara, Román, the Minister of Labour and Social Protection of Chile, and then Saravanan Murugan, the Minister of Human Resources from Malaysia. And our final message comes from Hanna Sarkkinen, the Minister of Social Affairs and Health for Finland. But first, the Minister from Tunisia, Malek Ezzahi, kicks off.
يسعدني أن أتوجه إليكم بهذه الكلمة بمناسبة الاحتفال باليوم العالمي 20 للسلامة والصحة المهنيتين الذي يلتئم هذه السنة تحت شعار إرساء ثقافة إيجابية للسلامة والصحة المهنية تغذيها المشاركة والحوار الاجتماعي. وهذه مناسبة للتأكيد على حرص تونس على ضمان الحق لكل مواطن ومواطنة في العمل اللائق والتزامها بالتشريعات الدولية المتعلقة بالحقوق الأساسية للعامل. إن السلامة والصحة المهنيتين رهان حضاري وحقوقي تسعى الدولة التونسية لتدعيمه باعتباره ضمن أولويات سياساتها، وذلك باعتماد مقاربة تشاركية لتنفيذ برامج وقائية كفيلة بتوفير شروط مقومات العمل اللائق. وقد صادقت تونس على 65 اتفاقية عمل دولية، آخرها الاتفاقية رقم 187 التي ستدخل حيز التنفيذ بداية من شهر جويلية 2022، مما سيمكننا من وضع سياسة وبرامج وطنية للوقاية من الأخطار المهنية بالتشاور مع الشركاء الاجتماعيين وإجراء التحسينات المستمرة التي ترمي إلى تدعيم ثقافة الوقاية من الأخطار المهنية لدى أطراف الإنتاج لتحقيق بيئة عمل آمنة وصحية. وفي هذا الصدد تعتزم الحكومة التونسية بالاشتراك مع الشركاء الاجتماعيين الانطلاق قريبا في جلسات العمل لتفعيل بنود هذه الاتفاقية، كما أن مخطط التنمية لسنة 2023 إلى سنة 2025 يتضمن من بين محاوره وضع استراتيجية وطنية للوقاية من الأخطار تهدف إلى النهوض بالصحة والسلامة المهنيتين في القطاعين الخاص والعام، بما في ذلك الوظيفة العمومية، مما سيساعدنا على المصادقة على اتفاقيتي العمل الدولية رقم 155 بشأن السلامة والصحة المهنيتين وبيئة العمل، ورقم 161 بشأن خدمات الصحة المهنية. ويعتبر المجلس الوطني للحوار الاجتماعي الذي تم أحداثه سنة 2017 الإطار الأمثل للحوار بين الحكومة والشركاء الاجتماعيين حول السياسات والاستراتيجيات الوطنية في مجال الصحة والسلامة المهنيتين لضمان شروط العمل اللائق. كما أن تطبيق الاتفاقية رقم 187 ستمكن من مزيد النهوض بالحوار الاجتماعي بين أطراف الإنتاج، وذلك في إطار لجان الصحة والسلامة المهنية، وهي إحدى هياكل الحوار التشاركي داخل المؤسسة، والتي من مهامها اقتراح برامج وقائية كفيلة بالتحكم في المخاطر المهنية بمواقع العمل والمساهمة في إرساء مناخ اجتماعي سليم. وقد كان لهذه اللجان دور فعال خلال جائحة كوفيد-19 من خلال وضعها بصفة تشاركية لخطط عمل للتصدي للجائحة واستمرارية نشاط المؤسسة. وتجدر الإشارة إلى أن التجربة التونسية رائدة في مجال التكوين المستمر لإطارات الطبية والتقنية المختصة في مجال الصحة والسلامة المهنيتين من خلال ما يقدمه معهد الصحة والسلامة المهنية من حلقات تكوين ونشريات علمية، بالإضافة إلى المساعدة المزدات للمؤسسات في مجال التحكم في الأخطار المهنية. وفي هذا الصدد فإن معهد الصحة والسلامة المهنية لا يزال يحظى بدعم منظمة العمل الدولية من خلال البرامج المشتركة التي تعنى بتركيز ثقافة الوقاية داخل المؤسسات. كما نسعى بالتعاون مع منظمة العمل الدولية لتوفير الإمكانيات اللازمة التي تؤهل المعهد لأن يكون له إشعاعاً عربياً وأفريقياً.
Hola, soy Jeannette Jara, ministra del Trabajo y Previsión Social del Gobierno de Chile. Y este 28 de abril queremos ratificar nuestro compromiso con la seguridad y la salud en el trabajo. Sabemos la relevancia del diálogo social y el tripartismo en esta materia. Y por eso, desde una perspectiva inclusiva, queremos llevar adelante medidas que tomen la mejora continua como un proceso en el cual miremos, revisemos y propongamos las adecuaciones y las modificaciones necesarias para proteger la salud y la vida de las y los trabajadores. Con perspectiva de género, mirando y atendiendo los riesgos psicosociales, reduciendo los riesgos laborales, porque creemos que una cultura sana es contributiva a un buen vivir. Actitud positiva para la seguridad y salud en el trabajo de forma inclusiva en nuestro lema. Y en ese camino estamos avanzando hacia el trabajo decente.
It is both honor and privilege to be speaking at the World Day for Safety and Health at Work 2022. And I wish to congratulate the International Labour Organization for organizing a good and meaningful event. I understand this is a very important annual affair for everyone in the field of work, which places key emphasis on safety and health at the workplace. As a Minister of Human Resources, I'm pleased to lend my fullest support to this event. ILO is undoubtedly very committed to safety and health, and it has demonstrated remarkable improvement over the last few years in regards to shaping policies. There is no doubt that Malaysia intends to adopt a positive, safe, and healthy work culture amongst its working population. There must be a reminder to both employers and employees of their respective responsibilities in adopting and implementing good OSH practices. Ladies and gentlemen, Malaysia's commitment to occupational safety and health at workplace is reflected through the enactment of the Occupational Safety and Health Act 1994, or OSHA, the setting up of the Department of Occupational Safety and Health, DOSH, and the establishment of the National Institute of Occupational Safety and Health, NIOSH. Malaysia to NIOSH wish to continue its cooperation with external parties from local or abroad, which enable it to further enhance its activities in safety and health at the workplace. This cooperation will be both local and international organizations, either informally or through Memorandum of Understanding. It is my humble belief that the close relationship with ILO will continue for future collaboration. In conclusion, employers should make sure that the appropriate tools to collect, analyze, and organize the information needed to maintain a safe and healthy working environment are made available. Therefore, I hope that all parties can practice and emphasize the positive safety and health culture while at work and wherever you are. In fact, not on April 28 only, but throughout the year. Thank you.
Dear friends, we are in the middle of profound changes. The COVID-19 pandemic and climate change, new technologies, new forms of employment and changing demographics challenge us to approach the world of work in a new way. Our government believes that the well-being of people and the planet needs to be placed at the heart of decision-making and be considered as a contribution to sustainable economic development. When discussing occupational safety and health, I want to underline the need to take better into account the diversity in the workforce, such as precarious and atypical work, as well as persons in vulnerable positions, including migrant workers and other minorities. Dear friends, strong social dialogue and engagement with all stakeholders is crucial in the process of securing a safe, healthy, and decent working life for everyone. High degree of unionization and the role of the social partners have been cornerstones of the Nordic welfare state model. Finland has a long tradition of strong tripartite cooperation between the government, workers, and employers in occupational safety and health issues. In order to build a positive safety and health culture, we need strong social dialogue and we need to act together. We must leave no one behind. Finland is highly committed to promoting safety and health at work, both nationally and globally. The Global Coalition for Occupational Safety and Health is an excellent environment for finding solutions to tackle the new challenges. I would like to thank the ILO for the crucial role in promoting safe and healthy working conditions worldwide. Thank you.
And you heard there's some important messages from the labor and health ministers from around the world, from Tunisia, Chile, Malaysia, and Finland. Well, next, let's hear from the international organizations for employers and employees. I'd like to introduce Roberto Suarez Santos, the Secretary General of the International Organization of Employers. The floor is yours.
Thank you very much. It's a pleasure to be here with all of you in an important celebration. Last year and the year before, at the World Day for Safety and Health, we clearly refer to the change on the preventive culture at OSH. And we clearly refer that those who think that OSH will continue to be the same after the pandemic are wrong. OSH at the workplace is becoming a top priority, not just for workers, not just for companies, but also at the policy making level. Fortunately, we are not at the same level in terms of COVID prevention, but there are important lessons learned out of this pandemic. The first one is that throughout this crisis, we have seen that having a robust OSH system has been critical not just for the health and safety of workers, not just for the productivity of companies, but also for business continuity. Never before, OSH was such a critical element to assure the continuity of business. Second, the active engagement of the private sector, the active engagement of employers is becoming increasingly crucial for a preventive culture. And I'm daring to say that employers appear to be a highly reliable partner for preventive policies. In some cases, frankly speaking, in some countries, it has become even a more reliable partner than some institutions. We need to build on this trust relation to make progress on a preventive culture. Also, private sector cooperation on health infrastructure, access to medicines, access to vaccines, and equipment is essential, not just to get out of this crisis, but also to achieve the SDGs. Don't take this cooperation for granted. We need also to build on it with a sense of joint responsibility. Fourth, and more importantly, workers and companies, workers and employers, both on small and medium-sized companies and also big companies, have suffered from uncertainty in terms of guidance, in terms of instructions, when they had to deal with the pandemic. This guidance on masks, distance, vaccination, remote work changed every month and also every week. In some countries, also it came from different public institutions with very contradictory messages. We need to overcome that. And for that, and that's perhaps the most important message, social dialogue is of essence. Social dialogue has been essential for ensuring implementation of these measures and to overcome this uncertainty. Social partners have been very active in producing materials, but also other resources and providing effective and coordinated information. The content of social dialogue has shifted also during the pandemic to deal more and more with prevention. And this idea of cooperation, this idea of preventive culture is vital to make OSH an absolute priority and also to get OSH as a fundamental principle and right of work, something that we will be discussing in the International Labour Conference. Remote work also, the use of digital tools is here to stay also. And remote and digital work means that we'll have to be more serious when facing new challenges like disconnection, mental health, and digital dependency. But also, we all have to assume our own responsibility, not just employers, also workers. There is a kind of sense of shared responsibility in a preventive culture that we need also to face. Finally, it's also important that health and safety preventive culture goes beyond the workplace. We have done little, to be frank, to get the informal sector on this path. The 60% of the occupied population did not have access to vaccines, masks, and even to proper guidance on dealing with the pandemic. And the results were not good. The vaccine and health prevention divide between developed and developed economies is a big problem, and we need to face also that in a serious manner. Count on our fair commitment as employers' organizations in the big community of IOE to getting OSH as a top priority. Achieving safe and health at work is a shared responsibility, and we believe that social dialogue needs to be reinforced to achieve an impact on a preventive culture. Thank you for listening to me.
Thank you so much for that, Mr. Suarez Santos from the IOE. And now we can go to Sharon Burrow from the International Trade Union Confederation. Sharon, the floor is yours.
Thank you, and my greetings to all of you, and to Roberto in particular as the employer's representative here today. This is a very important day for workers. Today, we remember the dead. We lament their passing in what could have been prevented if we had a more robust occupational health and safety culture. But indeed, we also determine as unions to fight for the living, to fight for those safe workplaces that the ministers and Roberto's have described. I also want to acknowledge that the Russian invasion of Ukraine has made the very living standards of workers around the world, starting in Ukraine, but then the refugees, and now with inflationary prices in terms of energy, commodities, then in fact you have increased poverty, insecure work, and very risky environments. Our heart goes out to those people directly in the line of fire, and we pledge to support refugees into work, but also into safe workplaces. But this year is a very important year. This is the year we will see occupational health and safety a fundamental right. We committed to this in 2019 at the Centenary Declaration. It's a tripartite commitment. We must see occupational health and safety absolutely put at the heart of workplace cultures that are preventative of injury and death. And when you know that almost 3 million workers, and they're the reported deaths, die every year, and that there've been 9 million since we committed to this in 2019, plus, 1 billion workers or more who've suffered workplace-related injuries of a non-fatal kind, but nevertheless have the capacity to destroy livelihoods for themselves and their families, then it's time to act. We want to see, of course, Convention 155 at the heart of this. We also draw your attention to other conventions, 161, 187, but also those conventions that are specific to sectoral occupational health and safety. And we will urge all governments to actually ratify those conventions. I want to particularly acknowledge the Portuguese Minister, Ana, and as a labour inspector herself in a previous working life, then she said it all. Labour inspection is critical. We have to have the support of robust labour inspection and sanctions to make sure that those who aren't following the rules, who aren't committing to the kind of workplace cultures we want, are indeed sanctioned to ensure that lives are protected. I'd like to draw your attention to other conventions. Convention 190 for women, but also for men, eliminating workplace violence, seeing violence-free workplaces. It's really important that governments actually commit to ratifying and legislating around Convention 190. And we don't just want to see the rule of law. We want to see accountability with indeed mandated due diligence, where employers assess the risk, where they put the grievance procedures in place to effect remedy, but also to ensure those joint committees which can help prevent and correct workplace safety risks. That means social dialogue. It means representation in the workplace. It means that freedom of association and the right to indeed engage in social dialogue and bargaining around these issues are absolutely critical. I wanted to underscore what Roberto said. The pandemic taught us all that you can't ignore workplace safety. To see that our very hospitals, let alone those essential services, were not geared up with PPE. The failure initially to recognise from the health authorities that workplaces, health first, but all workplaces are sources of infection and indeed, if managed properly, can be sources of prevention of disease for the community. We look forward particularly to negotiating a biological hazard, a standard on biological hazards in 2023, we hope, and 2024. And finally, I would say to you that the right to refuse unsafe work. Again, the Minister for Portugal raised it, but it's absolutely critical. Workers will be the first people often to know that they're putting themselves and potentially communities at risk if they don't act. So that fundamental right to refuse unsafe work must be respected by all. And Roberto touched on it, other ministers did too. New technologies, some are charted ground for us, some are uncharted grounds, but we have to be conscious at all times that we are in fact keeping up with the risks of workplace culture. So let's celebrate this year occupational health and safety as indeed a fundamental right. And I look forward to seeing those positive negotiations as an outcome from the ILC. We need the support of all governments. We need the support of employers and workers to actually that culture of both prevention and indeed remediation that is so important. But I cannot leave you without saying that we must start to recognise the underreporting. We must actually formalise our systems. We must formalise work so that workplaces and workplace hazards in the informal economy are recognised, but we must not let governments indeed not have in place the systems to recognise both recording and therefore the remedy to create those safe workplaces where prevention is at the forefront. Thank you very much. And I thank you all for paying attention, particularly on this day, to improving health and safety in the workplace.
Well, thank you so much for those insights, Sharon, Burrow from the International Trade Union Confederation. Certainly, thank you both to the employer and the employee representation. And now we can try to understand the ILO strategic direction on occupational safety and health. And I'm joined by Joaquim Pitado Nunes, the branch chief of Labadmin OSH ILO, and Manal Azi, the OSH team lead. They join us now from Geneva. Now, Joaquim, let's start with you because we know occupational safety and health is really becoming the center of attention globally, as we've heard from all our previous speakers. So how is the ILO observing this evolution?
Yes, as a matter of fact, several circumstances have led in recent times to an increase of the global attention to occupational safety and health. For example, when looking back, we can see recent commitments of global major players, for example, the G7 and G20 that have had the opportunity to express in several declarations that occupational safety and health is, as a matter of fact, something of the highest importance. We also have seen in the ILO a growing rate of ratification of OSH standards, in particular, Convention number 155 and 187. So, for example, since January last year, we saw an increase of 21 ratifications of these standards, which is for a period of 1 year and a couple of months, something that I would say as being quite positive. And of course, as you all said, the pandemic played a major role here. Nowadays, today, it's impossible not to acknowledge that the lack of safety and health in workplaces has effects much beyond the workplace, into communities, into the systems of public health, and also into social and economic development. So this is, as a matter of fact, something that is clear to all of us in the ILO, for governments, for employers, and for workers. Also, as noted by Sharon and by Roberto, the ILC will decide this year in June if, as a matter of fact, occupational safety and health, or one or more conventions on occupational safety and health, will become what we call a fundamental principle and rights at work convention, which means that, well, first of all, this would reaffirm the constitutional objective of the organization, of the ILO, related to the protection of workers against sickness, disease, and injury arising out of employment. But also it would ask all of our member states to recognize, to promote, and to realize the fundamental rights to safe and healthy working conditions or working environments. And I do hope that gradually steps will be undertaken for a progressive decrease in the number of injuries and diseases related to work. Progress has been made in most of the countries, but we are still very far from a satisfactory condition. Some estimates were already mentioned, and they are also in the report already available online, which do let us know that the situation is still alarming, especially when it comes to occupational diseases that represent something as 81 to 82% of all the fatalities related to work. And again, when referring to occupational diseases and fatal occupational diseases, it's not only the fatality, it's also the fact that this represents, in many cases, many years of suffering for people. But independently of the figures, of estimates, of real statistics that we receive from our member states, well, we are dealing with human life, which is the most important asset that we have. And from a NOSH perspective, all accidents, all diseases are preventable. But this is something that requires, first of all, investment, and also requires the active collaboration of all the stakeholders, and above all, governments, employers, and worker organizations, and of course, employers and workers that need to work in collaboration at the level of the workplace. Well, they all have different roles and responsibilities, but we will never make effective progress if OSH is not high on the agenda of all of them, governments, employers, and workers. Well, the ILO has a very special approach to occupational safety and health that I would say is unique within the UN, and this has influenced national legislation and practice all over the world. And this unique approach to occupational safety and health is that the ILO's approach to OSH is a tripartite approach. And you see that throughout all of the OSH conventions, guidelines, codes of practice on safety and health at work, social dialogue and collaboration between governments, employers, and workers is always present. It's always present in terms of formulating national policies, in terms of formulating national programs, in terms of setting up national systems, and also, of course, at workplace level when managing occupational hazards. And this is exactly what characterizes what we would call a preventative safety and health culture, which in an ILO context, and this is expressed by one of our conventions, convention number 187, is defined as a culture in which the rights to a safe and healthy working environment is respected at all levels, and where governments, employers, and workers actively participate in securing a safe and healthy working environment through a system of defined rights, responsibilities, and duties. So last year, Safe Day was dedicated to the need of investing in sound and resilient OSH systems. And this year, Safe Day is dedicated to social dialogue and collaboration between employers and workers. So I would say that this would be, in my personal opinion, the two characteristics, the two features that would help us to move forward safety and health at work, independently of what we would say or what we would express as being the strategy of the ILO, which is well defined, it is well known since 2003, and that it is developed through several interconnected pillars. What would characterize the work of the ILO moving forward would be exactly the strength that comes from our tripartite approach to occupational safety and health, and also what we can advocate at global and at national level in terms of investing in national OSH systems, investing not only financially, but investing in capacities of countries and investing in capacities of organizations. So this is what I would say would be the strategy of the ILO moving forward, in addition, of course, to the possible integration of OSH within the framework of fundamental principles and rights at work, in addition to, let us say, the update or the refreshment of the ILO's normative framework on occupational safety and health. As Sharon was saying, we are preparing standard setting on biological hazards, chemical hazards will follow. We also have in our plans standard setting on ergonomics, on safety of machinery. We are undertaking also quite important work in terms of having the UN conveying a coherent approach when it comes to occupational safety and health. But again, going back to the main features of what would characterize our approach to OSH would be the fact that any strategy that the ILO would implement would always be a strategy that is tripartite. So with this, back to you.
Thank you so much for your incredible insights, Joachim. And I'm conscious of the fact that we are running low on time for the rest of our session, but we can go to Manal next. And Manal, can you tell us what it takes to build a positive culture of safety and health at work? And what are the different stages of really developing such a culture?
Thank you so much, Sharon. Obviously, this is the theme of the Safe Day today. And a positive safety and health culture is one where management and workers value the right to a safe and healthy working environment. And we can only do that through effective communication and participation and dialogue leading to that effect. And to have that, it means we have a place where workers feel safe. They feel safe to voice their concerns. They feel safe to point out near misses or other incidents that happen in the workplace. And obviously we can't get there very quickly. There are many elements leading us there and core values we need to be respecting. Two key words I would say are leadership and commitment from senior management, because we have seen that the way workers perceive that the attitudes of managers towards safety and health is and their behavior actually dictates how workers behave in terms of safety and health. So it's very important how we perceive management and their actions towards safety and health. And some of these core values are very much embedded in the way we organize safety and health at our workplaces. We could have everything in place. We could have a system where we have reporting, analysis of safety incidents and concerns. But what's important is the willingness and the competence of management and specialists to actually take the conclusions needed from these systems that we have in place and actually guide and configure a restructuring or reform as work changes worldwide that actually takes into consideration the concerns that have been voiced. Because something that discourages workers sometimes is that they do voice concern. Either they are not addressed like they should, and so they won't voice concerns or report at a later stage, or they are valued and change is made. Well-managed organizational change is crucial in this future of work that we will be discussing throughout our panel. And to build that, we need to believe that we are heard and that the managers are taking the right action. And the key words here are also trusting our workers and actually taking action to what that is being suggested, and building the social justice that we need to be having at an organizational level, organizational justice, to make that change. And very quickly, the steps we need to get there is there are different stages. What we see around the world is organizations who could definitely not care about safety and health concerns. They happen. There is this no caring OSH culture. We can move to reactive, where an accident happens. We see that a lot, or lots of diseases, or something like the COVID-19 happens and everybody is reacting, and that's sort of a reactive or blaming culture. Who do we blame when something wrong goes wrong, or a calculative one where we actually plan and we prepare against and put on measures against all hazards. Moving to a better scenario would be a proactive culture where workers do not work to fix problems, but actually work on finding them and preventing them before they happen. And in an ideal world, we would have a generative OSH culture where it is actually integrated and been built into the work that we do and into everything that we do. And it's not just a safety and health issue on the side, not to mention that this will lead to better productive businesses worldwide. Thanks, Sharon.
Well, thank you so much for that, Manal. Really well said and some excellent insights. We can now move on to our roundtable discussion, which is really looking at a little bit of what you've all spoken about, the importance of social dialogue for a culture of safety and health. And I'd like to introduce our speakers now. We have Yuka Takala. He's the Executive Director Emeritus from the International Commission of Occupational Health, or ICO. Ruth Wilkinson, the Head of Health and Safety from the Institution of Occupational Safety and Health, or the IOSH. Jogindra Samant, the Chief Medical Officer of the Norwegian Labour Authority. Ms. Alke Bosinger, the Deputy General Secretary of the UNI Global Union. And Chris de Meester, the First Advisor for the Federation of Enterprises in Belgium. Well, welcome all. I'll start with the first question, which is the same question I'm going to ask all of you. And please keep your answers to just a minute each in the interest of time. And the question is, is it fair to say that occupational safety and health issues are really more in the spotlight now than ever before due to the pandemic and, of course, the urgent need to protect frontline and essential workers? Or has it always been a major issue? Let's start with you, Yuka.
Thank you very much. And good morning, good evening, good afternoon for everybody listening to this all over the world. And I think the question over here is that, yes, I think both in the past has been important and both also in today and also in the future. This is something what safety and health is important for our whole economy. Workers produce everything what we have. The GDP globally is produced by work. So this is an important thing to keep in mind, that if we hurt the production of the goods and processes and materials of our whole global economy, then we are losing, all of us. So maybe just I go back to the history a little bit, because I'm now representing the International Commission of Occupational Health, but I used to be also in charge of setting up this program of in 2003 of the the safe day, the day of workers' health and safety for all over the world. And I think this started from the point at that time when we had already the Workers' Memorial Day, and it was one of the starting point when the Safe Work program in the ILO and workers' activities joined by the employers wanted to get together to do something. Here we have the picture of Juan Somavia, the Director General at that time, and he is introducing the 2003 component, three particular process, and then we have the employers, of course, Mr. Peñalosa, the workers, Mr. Oliveira, governments, and office myself in that particular position. And surprise, surprise, the theme at that time was safety culture at work, exactly as today. So I don't think there's much of a difference today and in the past. And then maybe developing from that, we then had many other items. For instance, in 2004, one day later, we had not only the ILO Director General, but the President of the Government of Finland was making a healthy contribution for that. And also we heard of the UN Secretary General, who said, for example, that safety and health is not only economically feasible, it's a basic human right. So I think this is the introduction for this particular thing. We come back to those discussions later.
It is indeed. Thank you so much for that, Yuka. And we can move on to Ruth Wilkinson now. Of course, we know OSH issues have always been in the headlines. Can you tell us more?
Yeah, thank you, Sharon G. Thank you for having IOSH here representing as well. As representing the chartered body for occupational safety and health professionals, we've certainly seen that our members have felt more valued during the period of the pandemic. So the pandemic, you think about your workplaces, the workers, the employers, they've certainly recognised the importance, impact, contribution of good OSH to keep the supply chains, the workplaces open for essential workers, people to return back to work. So it's definitely been in the spotlight, Sharon G. But whether it's any more important now than before, I think we saw the numbers at the start on the video that millions of people are still dying through the nature of the work that they're undertaking. So people at work, others who can be impacted through that work. So we've still got a lot of work to do. And we can see that through the fabulous discussions we've had so far, that we've all got that role to play, that collaboration. So it's in the spotlight. We need to take this moment now to continue the profile that we've got of good occupational safety and health. And we recognise that actually fatal injuries at work, they not only cause significant human, social and economic costs, but they obviously negatively affect workers and their families, as Sharon mentioned earlier, also to all organisations, communities, wider society. So both government and corporate action is needed to ensure the safety and health of all. So yeah, I'll keep still at 1 minute, Sharon G. But yeah, it's always been important and we like to see that momentum continue.
Much appreciated. Thank you so much for that, Ruth, and some great insights as well. We can move on to Yogendra next. Do you believe that we're at this special moment where OSH issues are in the spotlight, or have they always been, in the spotlight, something that we should be focused on?
Thanks, Sharon G. And I am representing the government in every sense of the word, and the Norwegian government here, but the perspective from the third part, if one might call it. And answering your question, the Safe Day is to honor the people who have lost their lives, but it's also a day to increase awareness and celebrate prevention. And we have done that, as Yuka said earlier here, that we have been doing that since 2003. Since its inception, we are doing things to increase awareness, to prevent work-related diseases and fatalities. And our past is something that we cannot change. Lives lost, limbs lost. However, from the learnings that we have and the mistakes that we made, we can shape the future, a better, safe, and a healthy future of work. So to answer your question, in short, we have been doing it, but we need to be even better. And what better an occasion than to sort of promote this, working together with the employers, with the workers and governments and other agencies going into the future. Thanks.
Thanks for that, Yogendra. And now we can go to Alki Boesinger. Is that something you agree with?
Yeah, absolutely. I would agree with that. And I would like to actually thank Sharon for framing so well from a worker's perspective all the issues that are associated with occupational health and safety, and particularly in relation to this particular day. And really what we have seen throughout the last 2.5 years is that the COVID-19 pandemic really has had a lasting impact across the entire services sector, which my organization UNI is representing, and has really brought this issue of occupational safety and health to the forefront in this global conversation about workers' rights. And what we've really seen is that the important role that unions are playing to keep workers safe, because we've seen strong evidence that without unions, the pandemic would have been far more deadly and the working conditions would have been even less safe, and essential workers would not have had the dignity and the fair pay that they deserved. Because in the workplaces where workers had no voice on the job, there was no PPEs, as was mentioned before, there were no safety protocols negotiated, which put those workers really at a lot higher risk than the colleagues in companies where they have a union or a health and safety committee. So I think health and safety is really an issue that we need to keep focusing on.
Thank you so much for that, Elke. And finally, we can hear from Chris as well. Chris, our opening question, which is, are we focused on this now because of the pandemic, or has it been always a big issue?
Well, I think for decades, the people in the occupational safety and health community have been working really hard, but in the shadows. Even in the photos that Yuka showed us, you see the high-level people who endorsed the 2003 conclusions on safety and health at work, the people who created the conclusions, the people who defined the concept of a preventative culture. You don't see them in the photo. And I hope now that because of the pandemic, the people who are working hard every day to keep workplaces safe, to make sure that workers are safe and healthy, that those people now get the respect and that we really start using their expertise and their sound approach towards for all challenges in community. In the pandemic, we saw a lot of panic at government level, ever-changing measures, messy, blurry communication, and at the same time you saw a very stabilizing factor, that is the health and safety people translating the principles of prevention into tangible measures during the pandemic at the work floor, using social dialogue, using expertise, and building upon decades of tools, risk assessment, prevention principles, to make the measures tangible, translate them into something pragmatic at the workplace to keep people safe during the pandemic. And I hope we can build now upon those lessons and use that power and use that dialogue to attack upon whatever challenges comes up in the future.
Thank you so much for that. Great introductions from all of you. I'm conscious that we really only have 15 to 20 minutes left to our discussion, so I really want to get to the nitty-gritty of it. So Yuka, I'm going to turn to you again. You showed us some incredible pictures of the number of years you have worked in this key sector, trying to protect workers, including, of course, your tireless dedication to increasing awareness about asbestos. So Yuka, tell us what's been your experience in collaboration with others and some of the key approaches and tools that will help. Yuka, are you there?
Yeah, thank you.
Yes.
Have to make sure that you are hearing me. From my own global experience, I think it's clear that the comprehensive package of measures must be containing, for example, ILO and the national regulatory framework. That's number one. Enforcement, number two. And then number three, really important, highlighted already by many, particularly employers and workers, the workplace level collaboration. So at the workplaces and also nationally and internationally, really important. Without those, we cannot get far. That also means that we have a 3 Ps, P for prevention, P for protection, and P for promotion. And all of those will have to go together. I would add, based on this COVID experience now lately, add one more P, the preparedness, that we have to anticipate things in the future and look what are the problems in the future, not only for preventing and protecting today. But these are key points, but in general, important things. Equally, what is important to have the management systems at the company level, governments to set the scene. If the governments don't act over there, not much will happen. I just had a meeting with the Korean Economic and Social Council this morning on the April 28th, and we were talking about safety and health culture, and they asked us how to build the culture in Korea, and they wanted to get the experience from, particularly from the European Union countries, how it has been built here. And I think this should be globally invited. One important thing is also to have the zero harm as a long-term vision, that all problems and hazards, they are caused not by tsunamis or nature or anything like that. They are made by humans to humans. So I think they are also preventable, and important thing to keep in mind. So this is something that not only for one day going to work and coming back in the evening, but for the lifelong work, covering short-term problems and long-term problems, that people who enter the working life at the age of 20, retiring still safe and sound at the age of 20, 68 or whatever they retire. Right. Thank you.
Thank you so much for that, Yuka. Some great historical perspective there. Ruth, over to you next. I mean, we've been hearing all about the roles played by employers, workers, and other actors in creating a positive OSH culture. But tell us, how do all of these issues fall within the sustainability agenda and the wider context?
Yeah, lovely. Thanks, Sharon G. And I'd like to build on a bit of what Manal mentioned earlier about creating that culture, and also a bit what we've just said about, is it important here and now? And the world of work is changing. We are seeing that there's new job creation, new jobs coming to the fore that haven't been happening before, new technologies coming around. We're seeing the informal economy expanding, the rise of the digital platform workers, bringing forth new risks. So we need to ensure that we embed focus on occupational safety and health through everything that we do, from top down to bottom in the organisation. So Sharon G, you just mentioned all the actors. To do that, we've all got a role to play. So if we think about governments, the policymakers, the employers, the employees, the regulators, it's one complete system. Not any one can be effective in its own way. That to actually drive that change and that right culture, everybody needs to play their part, know what their part is, understand those requirements, and so on, really. So if I just break it down a little bit, if I start at the bottom first, thinking about the employers, the organisations, hopefully we can all relate in our own workplaces or people who we know and where we see in our communities. But at that organisational level, we need to ensure that we integrate occupational safety and health into core business. I've seen it as standalone, separate, but it really does need to be integrated to drive that change and to be recognised and managed like any other business risk. So we're talking about good occupational health and safety management at that organisational level, and also that culture that Manal was talking about, that it's just something that happens there through the shared attitudes, values, the beliefs of that organisation. And we need it to be proactive and positive, preventative and inclusive, so it's covering everybody. The cultural side, Manal again also talked about leadership, strong, visible, active leadership. Leaders need to be talking about this, role modelling, ensuring it's being led from the top. And we also need to ensure that we've got workers who are also involved. And again, if I think about UK legislation, our consultation legislation, there are avenues there for employers, the employees, either through employee reps or trade unions, to talk about health and safety, any new measures, any new equipment, any competency training. We need to make sure that this happens, and we've got that leadership, workers are involved. COVID, we've definitely seen the rise of these conversations, people wanting to come to work, what measures can we see in place, but it should cover the whole spectrum of that work. And then likewise, governments, policymakers, regulators, we need to see OSH embedded at that level. So it's asking the right questions. We advocate for non-financial reporting so that health and safety will get more visibility, it'll be actioned, which links me to your sort of key bit, Sharon, about the sustainability agenda. So it's at IOSH, we are truly looking to put people back into sustainability, looking at the value that people can give back to that organisation. So in the current world of work, we believe that organisations cannot be sustainable without protecting the safety, health and well-being of their most vital resource, the workers. Socially sustainable organisations prioritise the adoption of person-centred approaches to everything that they do. And if you think that if people are looked after in the workplace, they're more motivated, they're engaged, their morale's high, they're more loyal, they're more satisfied. So there's wider benefits for doing all of this, bringing in human rights, equality, and into that human capital agenda. So again, I will stop there. Thank you, Sharon G.
Thank you so much for that, Ruth. And we can move to Yogendra now, because Yogendra, you're talking from the Norwegian point of view. So tell us about the role of governments in facilitating and acting together for OSH, and how can this be ensured through regulation and cooperation?
Sure, thanks, Sharon G. And I'll try to complement what Yuka and Ruth has said. But yes, this is the government's perspective, and we have to be the mediator to support, to resolve, to reconcile so that the social partners, that is the workers and employers, promote decent jobs and ensure worker protection. So we have to see to it that the dialogue, the social dialogue, is productive for all partners concerned. So we have productivity on one end of things and good and decent work and worker protection ensured. So I'd like to make succinctly a few points here. First, in Norway, and I could speak with Scandinavia as well, at the enterprise level, we emphasize having representative safety committees where employer and worker representation handles and addresses occupational safety and health issues. It's important that people are elected rather than nominated. And in many ways, these effective safety committees represent a democracy in a microcosm, because you get to see how a workplace could be the world and how decisions are influenced for betterment both of economics, but also protecting health. Point two, at the national level, we have the tripartite dialogue. We have the labor unions on one side, both small and big, and the employers unions. And then we try to come to consensual solutions. But what's important, and Manal said that, we trust in each other. It's a fair and open process. And perhaps I could say we trust the collective wisdom of the tripartite network. And then I would like to add here, in Norway, we actually have gotten in the research organization in Norway, the STAMI, also into the tripartite network, because they provide us knowledge and then the discussions and proposals for policy interventions to improve OSH could be made on sound evidence. So we have sound evidence on one side from the research, but we have the collective wisdom of workers and employers and government sitting together to address issues. A fourth point I would like to make is, given the pandemic, and much has been said, that also as governments, we have understood the value of collaborating with other governmental agencies like public health authorities. The pandemic actually showed us that, and in Norway, we did that already in April 2020. We established a task force, and we also had inputs from our social partners to how we could protect workers, ensure business continuity, protect workers, and protect populations. And Chris said that very well. I think public health learned a lot from occupational health, how to apply hierarchy of controls, how to do risk assessments. And I think it was a win-win. So that's acting together in a broader sense, going a little beyond the social partners. And my last point, one of the things that I would like to say, and I'm quoting an earlier director of the Icelandic Occupational Safety and Health Agency. He used to say even Iceland is not an island in the globalized world. And that's so true. We have to work together, and therefore international cooperation for governments and labor inspections has been important. We have been working in the Nordic countries for the past 70 years on issues of occupational safety and health, on agricultural safety, machine safety, chemicals, occupational medicine. And we are committed both to better occupational safety and health in Norway and Nordics and Europe and globally. I'd like to conclude by saying that with my passion and possibly some competence in occupational safety and health, but I alone can only do so little. But with Chris and Yuka and Alke and Ruth together, we can do so much good. Thank you.
Thank you so much for that, Yogendra. Very, very well said indeed. And we've just got a few minutes now, but I do want to get to, obviously, Alke next. And just be very interesting to hear about how your organization aimed to keep essential workers safe during the pandemic, particularly in the care and retail sectors. And of course, based on agreements that had been negotiated by employers. So can you give us quickly just a view?
Thanks, Sharon. I'm very happy to do that. Just before I start, I just wanted to quickly follow up on something that Ruth and Yogendra were talking about with regards to health and safety committees. because I have been involved with the work around the Bangladesh Accord since the 2013 Rana Plaza disaster. And I just wanted to highlight here that the work that we have done as part of our program to build health and safety committees in the garment factories in Bangladesh, I think is really a testament to the importance of health and safety committees, because these health and safety committees are formed both by employers and workers together. They're trained together. And I think that's really on the notion of sustainability and making sure that workers and managers and everybody in a factory is safe are like an important instrument that has proven to be working. But let me come back to your initial question, which is to focus on the care and commerce workers and who've really been on the front line in the pandemic in an essential role. And I'd like to just give you a couple of quick examples of how unions have worked with employers to protect and support retail and care workers during the last few years. And I'd like to start with the guidelines that both of those sectors issued at the beginning of last year to keep workers safe. Now, in care, what we saw during the crisis was that nursing home residents had the highest death rates in many countries. And that also, of course, meant that long-term care workers became really vulnerable to becoming sick on the job. So what we did, we issued some guidelines which were supported by national and local unions, and we negotiated with employers immediate measures to keep both staff and residents in these nursing homes as safe as possible. And these provisions, they included proper PPEs, access to vaccinations, free COVID-19 testing, the provision of infectious disease training for nursing home workers so that they can protect themselves, but also the residents. And very importantly, also what we negotiated was paid time off for all the workers that got sick, because unfortunately, that is not a given in all countries around the world. But the situation was also bad in the grocery stores, where the workers remained out there working throughout the pandemic to provide people with food. And it was our goal, again, with these guidelines to protect both the workers, but of course also the customers. And what we did was we signed a declaration with 6 leading multinational food retailers from France and Spain, and they jointly represent a global workforce of about 1 million workers. And in ratifying this joint declarations, these retailers committed to working closely with UNI and their local unions on measures to control the risks of COVID-19. And it's really worth noting also that this declaration was an important step towards establishing a more sustainable long-term social dialogue with these companies, which we have not been working with closely before. And building on these guidelines that we jointly issued, some countries also actually took legislative initiatives. In Japan, for instance, the government issued policies to better protect essential workers. Or in Argentina, the government is considering a law to make health and safety committees mandatory in workplaces. And to maybe finish off with a national example, in the US, one of our affiliates, the United Food and Commercial Workers Union, they negotiated hazard pay that recognized the role that food retail workers played during the pandemic. And they also negotiated provisions for paid breaks to go wash your hands in between shifts, or paid leave for workers who had to isolate, or financial support for these workers for childcare costs when the schools were closed during the pandemic. So all of these, I think, are really good examples. We put them together in a report. So anyone who would like to know more about these different initiatives that have been taken together by trade unions and employers are more than happy to look at this report that we recently issued.
Thank you so much for that, Alkane. Great to hear how your organization dealt with some of those really crisis situations. Now, finally, we can end with Chris, and really interested to hear what you were talking about earlier about how all of this goes beyond the tripartite. So how can social partners address an OSH crisis situation through effective social dialogue? And is it an important lever for preventative OSH culture in workplaces and in society?
Yes, I absolutely think that social dialogue, the process of sitting together, employers, workers, is essential to make sure your approach comes to life and yields the results you're aiming for, a safe and healthy workplace. I will take one step back and go back to that definition of a preventative culture. It should be clear that this is something, it's not something you can dictate. It's not something you put in a national strategy or in some government declaration. It has to be brought to life. And don't misunderstand me. Of course, at national level, you need a sound framework, legislative framework. You need all of that. But that has to be implemented. It has to be brought to life. And there we absolutely need a bottom-up approach. Top-down thinking that, okay, I put it in a policy paper, and in 2 years, we will have preventative culture in all workplaces. Not working like that. So bottom-up, we have to sit together, talk, employers, workers, with, and here I come with a more inclusive approach, with the assistance, of course, of OSH experts, of OSH institutions, with the assistance and the support also of labor inspectorates, who can act as a catalyzer, but in the end, it will be the employer and the workers who have to come to a sound approach, to a good agreement on how to implement all the principles, prevention measures on the work floor. And there I believe that we as employers organizations and the workers as workers organizations, we have the mobilizing power. If you have our support, you immediately reach out to the majority of workplaces, to the majority of workers. That is the mobilizing power, that is the leverage that you need to bring those principles to life. And that is why I am still confident for the future, because Elke gave a lot of examples. I have many more examples where we saw that throughout the pandemic, by using this process, we came up with comprehensive approaches, and we created an environment where, okay, society was still under threat of a virus, but at least the workers sensed that at the workplace level, action was taken to make sure they were not more exposed than, let's say, you would always be in a society. So a positive note, I'm confident, let's use the power, the knowledge, and the mobilizing force of social dialogue, of social partners, and governments, of course, step in to facilitate this process, challenge us, push us, but each has to play their own respective role. Thank you.
Thank you for that, Chris. And indeed, some very valid and interesting points brought up by all our panelists. But sadly, we have run out of time in our roundtable discussion. But a big thank you to all our speakers and experts. A really, really interesting discussion there. And of course, as we continue to live through a global health crisis and face ongoing OSH risks in the world of work, we must, of course, all continue to move towards building a strong safety and health culture at all levels. And now I would like to give the floor to Vera Pecat Perdigao, the Director of the Governance and Tripartism Department at the International Labour Organization, for her closing statements. Over to you, Vera.
Thank you, Sharon. And good afternoon, good morning, good evening to all. I'd like to thank the panelists and government workers and employers representatives speaking at this World Day for Safety and Health at Work. It is encouraging to hear so many good examples and of our collaboration at all levels is helping to put effective OSH policies and practices in place and save lives. Thank you for your public commitment to improving a positive and sustainable occupational safety and health culture and strengthening social dialogue. In the past 2 years, and many of you share with us, all countries and business around the world had to adapt to the challenge posed by the COVID-19 pandemic. The ongoing crisis also has shown the importance of occupational safety and health, and our collaboration and social dialogue between workers, employers, and governments can reduce the risks and improve the safety and health in the world of work. Social dialogue improves the quality of policies, because employers and workers have in-depth knowledge of the needs and realities of companies and workplaces, and even more necessary in time of crisis like the one we lived, when quick responses are needed. We need also consistent action at all levels if we want to create safe and healthy workplaces and prevent disease and death. That means we need to prioritize. Governments need to prioritize workers' health and safety in national agendas and allocating enough funding resources to increase awareness and implement policies. It means also workplace complying with safety and health regulations, introducing OSH management systems, and promoting a positive OSH culture. It also means that workers' participation in the development OSH policies, which all have the evidence shows reduce accidents and injury rate. Everyone wins when OSH is made a priority, when there is adequate investment, when there is effective collaboration, and through social dialogue. The examples you share with us demonstrate once again how important the tripartism, the collaboration, the social dialogue at workplace are important. Not only those measures contribute to healthy workforces, but they also led to a productive enterprise and sustainable economies. So to conclude to this World Day for Safety and Health, I would like to emphasize once again on the urge to act together. Only through social dialogue, solid social dialogue, will be better equipped to face future crises and the many other changes ahead on the future of work. On that, I thank you again for joining us today. Over to you.
Thank you so much for that. And once again, a big thank you to all our speakers on this very, very important occasion for the World Day of Safety and Health at Work. And thank you again for all of you tuning in. Some really fantastic comments and content that you shared with us on the Zoom chat. So we hope you have a great day ahead. And thank you once again for joining us.